Can narcissists change? Insights on therapy and treatment. From the editorial staff of understandnarcissism.com. Exploring the challenges, possibilities, and realistic expectations for change in narcissistic personality disorder. The question of whether narcissists can change is both complex and deeply rooted in psychology and human behavior. Many people ask this question, often when trying to understand or salvage relationships with narcissists, whether they are partners, family members, friends, or colleagues. Narcissistic Personality Disorder, or NPD, is one of the most challenging personality disorders to treat. Still, recent research and clinical observations provide valuable insights into what change might look like for narcissists and the realistic expectations for therapy and treatment. Understanding Narcissistic Personality Disorder. Narcissistic personality disorder is characterized by a pervasive pattern of grandiosity, a constant need for admiration, and a lack of empathy for others. Narcissists often have an inflated sense of their importance and feel entitled to special treatment. They tend to disregard the needs and emotions of those around them, frequently leading to strained relationships. This ingrained behavior can be deeply rooted in early childhood experiences, typically as a defense mechanism against low self-esteem or past trauma. For many narcissists, their worldview and coping mechanisms feel natural, making self-reflection and emotional vulnerability, the cornerstones of change, very difficult. Is change possible? The challenges in treating narcissism. The notion that narcissists cannot change is partly true. Change is highly challenging, especially given that many narcissists do not see their behavior as problematic. The lack of empathy and genuine self-awareness, typical of NPD, poses a significant barrier to therapy. For treatment to be effective, an individual must first recognize that their behavior is causing harm to others and themselves. This level of insight is rare among narcissists, as it challenges their need to maintain their self-image. Critical challenges in therapy for narcissists. Lack of self-awareness. Narcissists often cannot see or admit that they have a problem, leading to resistance or rejection of therapy. Defensive mechanisms. Narcissists have developed these mechanisms over a lifetime to protect themselves from vulnerability, which can make it hard for them to accept criticism or guidance. Difficulty in empathizing. Without empathy, it's challenging for a narcissist to understand the effects of their behavior on others, which is often a crucial step in personal growth. Fear of vulnerability. Opening up in therapy means showing vulnerability, something most narcissists avoid due to their fear of being perceived as weak or flawed. The role of therapy and potential pathways for narcissists to change. While challenging, some narcissists can benefit from therapy, especially those with self-reflective tendencies or who have experienced a crisis that has forced them to confront their behavior. Therapy methods that have shown promise include cognitive behavioral therapy, CBT. This approach can help narcissists identify negative thinking patterns and replace them with more constructive, empathetic responses. Although CBT focuses more on behaviors than underlying personality structures, it can lead to gradual behavior change. Dialectical behavior therapy, DBT. Initially developed to treat borderline personality disorder, DBT has been effective for some individuals with NPD, mainly when dealing with emotional regulation and interpersonal relationships. DBT teaches skills for managing emotions and developing empathy, a crucial area of improvement for narcissists. Schema Therapy. This approach works by helping individuals uncover and address the deep-rooted, dysfunctional beliefs that drive their narcissistic behaviors. Schema therapy can be helpful for narcissists who are willing to engage on a deeper level, as it can address long-standing issues around self-worth and identity. Group therapy. While many narcissists struggle in group settings due to their competitive and self-centered tendencies, those who stick with group therapy can sometimes develop empathy as they hear others' perspectives. Group therapy isn't a cure-all, but can contribute to incremental change. The realistic goal: managing, not curing, narcissism. It's crucial to set realistic expectations when it comes to treating narcissism. A complete transformation is unlikely. However, some narcissists can learn to manage their behavior, develop greater self-awareness, and modify their actions in certain situations. Therapists and clients should focus on incremental change rather than expecting a cure. What encourages change? Motivation and crisis points. For narcissists, motivation to change often stems from crisis points rather than personal insight. They may face a failing relationship, a job loss, or legal consequences due to their behavior. These crisis points can force a narcissist to confront their actions and seek help. Without external motivation, a narcissist may never see a reason to change, as their behavior typically serves their self-interest. Advice for those in relationships with narcissists. For those wondering if a narcissist in their life can change, it's essential to focus on setting boundaries and taking care of their mental health. Change is not something that can be forced upon a narcissist. They must choose it for themselves. In the meantime, having clear boundaries can prevent further harm and reduce stress for the people around them. This act of setting boundaries can empower individuals in relationships with narcissists, giving them a sense of control over their own well-being. Hope, but not a cure-all. Can narcissists change? The answer is complex. While actual change is rare and challenging, it is not impossible. With the right motivations, a solid therapeutic alliance, and an openness to growth, some narcissists can learn to manage their behaviors and improve their relationships. However, it's important to remember that this is a rare occurrence. For those affected by narcissistic behavior, understanding the challenges and limitations of change can help them make informed choices about how to approach their relationships, prioritize their well-being, and set realistic expectations. The information provided in this article is for informational purposes only and is not a substitute for professional advice. We are not licensed clinicians, mental health professionals, lawyers, or legal advisors. For any concerns regarding mental health or personal situations, please seek advice from a qualified professional. For more details, please read our full disclaimer.